Welcome. My name is Chris Rowena, Communications Team Supervisor with Health Workforce Development at HCAI. We're so glad you could join us today for the California State Loan Repayment Program webinar. We're excited to share more about this important opportunity and walk you through the details of the program. Here's a quick look at today's agenda. Start out with, we have a housekeeping and introduction, followed by an overview of the program. And then we will have a question and answer at the end and a quick closing. Before we begin, I'd like to go over a few of those housekeeping items to make sure you get the most out of today's session. Number one, this platform, we are hosted in Zoom webinar. Your controls are at the toolbar, the bottom of your screen. In that toolbar, you will find the Q&A button. We will be using the Q&A feature for all comments and questions today. Please type your input at any time. Also, please use the upvote button on the questions that have already been asked if it's a question you have too. That will help us prioritize questions today. Number three, we are recording today's session. The recording will be available on our website typically within 10 business days, while we make sure that it is accessible for all of our audiences. Also want to note that if you click on the More button in your toolbar or down at the bottom, there should be a resource feature, and you'll find a link to the program webpage and grant guide and other resources that you need there. All right, let's jump on in to HCAI's vision and mission. I want to start with the foundation of all of our work here at HCAI. Our vision here at HCAI is a healthier California where all receive equitable, affordable, and quality health care. And our mission is to expand equitable access to quality, affordable care by supporting resilient facilities, a strong health workforce, and actionable health information for all Californians. Everything we do, from programs to partnerships, connects back to this mission. Go to the next slide. HCAI works across 5 major areas of California's healthcare system: facilities, financing, workforce, data, and affordability. Together, these programs help ensure California has safe healthcare facilities, access to financing, a strong workforce, reliable healthcare data, and a more affordable healthcare system. And for our workforce programs, we focus on making sure that California has the right health professionals in the communities where they're needed most. We support and expand the workforce serving underserved communities and Medi-Cal members across primary care, maternal health, behavioral health, nursing, and oral health. And with that in mind, let's jump into today's session. It's my pleasure to introduce Ashley Hall, Program Officer for the State Loan Repayment Program, to get us started. Ashley.
Hello, everyone. I'm Ashley Hall, a program officer for the California State Loan Repayment with the repayment of educational loans for healthcare professionals serving in federally designated health professional shortage areas or federally qualified health centers, FQHCs. Our goal is to increase trained professionals and encourage them to provide healthcare in California areas. SLRP awards up to $50,000 in
All right, it does look like we're having some technical issues with Ashley's connection here today.
I'm back in, Chris. Can you hear me?
We can hear you. There you are, Ashley.
Oh, perfect. Okay. I do apologize. Not sure what happened, but I'm going to continue.
All right. Carry
you.
on. Thank you.
Thank you so much. Our goal with SLRP is to increase trained professionals and encourage them to provide healthcare in California's health professional shortage areas. SLRP awards providers up to $50,000 in educational loan repayment grants in exchange for a service obligation at a qualifying site. Next slide, please. SLRP includes a federally mandated match requirement where all awards are to be matched dollar for dollar by federal funds from employer practice sites. For example, a grantee awarded $50,000 will receive $25,000 from HCAI, and $25,000 from the grantee's employer. Participation is optional. Therefore, if a site chooses not to participate, applicants from that site will not be eligible for the SLRP. Next slide, please. The application opened July 15th, 2026, and will close on September 15th, 2026. Awardees will be notified in January 2027 with an anticipated grant start date of March 1st, 2027. The last day to cancel the SLRP grant without breach or penalties is May 15th, 2027, and you can do so by emailing SLRP. SLRP is funded from the Federal National Health Service Corps and other grants. $750,000 will be available through federal funding, while $333,000 is available through state funding from Song Brown. Next slide, please. SLRP awards several amounts depending on full-time or half-time status, as well as options to extend the original grant for additional funds for qualifying student loan debt. The initial full-time award is up to $50,000 with a 2-year service commitment. First and second year extension up to $20,000, and third and fourth year extension up to $10,000, while the initial part-time award is up to $25,000 with a 2-year commitment, first and second year extension up to $10,000, and third and fourth year extension up to $5,000. Next slide, please. A few requirements for participation include being a U.S. citizen, possessing a valid license to practice one of the eligible disciplines in primary care, dental care, or mental health care, having no existing commitment or service obligation to any other program, and having qualifying educational loan debt. Next slide, please. Additional requirements include providing a 2-year service obligation when working full-time at 40 hours per week, or a 2-year service obligation working 20 hours per week at half-time. Be a California resident practicing your profession in California, completing the application through the funding portal. Failure to complete the application in its entirety and accurately may result in disqualification. If selected for an award, maintain employment for the duration of the service obligation at an approved eligible site that has been confirmed with its participation. Next slide, please. Here's a list of our SLRP eligible professions and specialties. Please see our grant guide for additional information. Next slide, please. Practice site eligibility requirements include being located in a HCCA or designated as an FQHC, public or private not-for-profit outpatient facility. The practice site administrator will confirm participation, including willingness and ability to provide matching dollar-for-dollar awarded funds. Please note that schools, school districts, correctional facilities, prisons, and providers employed directly by the state of California are not eligible for the SLRP. Next slide, please. Eligible debt includes government and commercial loans obtained for undergraduate and graduate health professional degrees from a qualifying institution such as Mohela, Aid Vantage, and Nilnet. Next slide, please. Full-time grantees must work a minimum of 40 hours per week. 32 hours of those must be in direct patient care. No more than 8 hours per week can be spent in an administrative role. And for half-time grantees, they must work a minimum of 20 hours per week. Excuse me. For half-time grantees, they must work a minimum of 20 hours per week with 16 hours in direct patient care. No more than 4 hours per week can be spent in an administrative role. Please see the grant guide for additional information and specifications. Grantees must email HCAI immediately if they're no longer employed by the approved practice site. And notification is required 30 calendar days prior to making major changes to your personal information. Switching from full or half-time status, or taking a leave of absence for more than 30 days for any reason. Next slide, please. A few more communication requirements include providing notifications 60 calendar days prior to taking a new position or making any changes to your employment status. Please note, grantees are allowed to miss up to 35 days per year. Missing more than 35 days per contract year will result in a grant and date extension. Next slide, please. SLRP breach of contract terms is very important. I will be reading the terms and conditions verbatim. HCAI, or their designee, reserves the right to recover the following amounts for grantees' failure to perform the obligations set forth in this agreement pursuant to 42 U.S.C. 254 OC. The total of the amounts paid by HCAI to or on behalf of the grantee for loan repayments for any period of obligated service not served, and an amount equal to the number of months of obligated service not completed by the full-time grantee multiplied by 7,500, or the half-time grantee multiplied by 3,750. Continuation service grantees shall be liable based on full-time or half-time grantee status at the time of the breach, and interest on the above amounts at the maximum, interest on the above amounts at the maximum legal prevailing rate from the date of the breach. Interest is calculated at the rate utilized by the state treasurer from the date of the breach, and the amount HCAI is entitled to recover under this section shall be no less than $31,000 plus interest, even if the breach formula from the above results in a lower amount due. Next slide, please. For a material breach of this agreement not having to do with the start or completion of grantee's period of obligated service, HCAI shall recover no less than $31,000 plus interest from the grantee, calculated at the rate utilized by the state treasurer from the date funds were sent to the grantee. In addition, if HCAI files a civil action to recover sums per this section, HCAI shall be entitled to recover reasonable attorney's fees, costs, and expenses directly related to such collection actions. Grantee will be ineligible to apply for any HCAI programs in the future if they breach or materially breach their contract, unless grantee obtains relief under Section I, provisions for suspension, waiver, cancellation, or voluntary termination of services. Any amount HCAI is entitled to recover from the grantee for breach of this agreement shall be paid within 1 year of the date HCAI determines that the grantee is in breach of this agreement. Per Government Code 16580 through 16586, HCAI has statutory authority to collect on any outstanding debts HCAI may attempt to collect from the Franchise Tax Board or any Medi-Cal offsets. HCAI may contact the Employment Development Department, the Board of Equalization, and/or a collection agency to obtain repayment of the funds owed. Next slide, please. A few resources that we have include the SLRP website, our SLRP grant guide, the online application portal, and the funding opportunity eligibility quiz, along with our technical assistance guide for applying for the SLRP program. If you have any questions in the future, please contact us through the SLRP inbox. Thank you. I will turn this back over to Chris for Q&A.
All right. Thank you so much, Ashley. Appreciate all of the hard work the team has done on this program. We're going to transition to our question and answer session. To ask a question, please use the Q&A feature located in the Zoom toolbar at the bottom of your screen, as many of you have already started doing. You can again submit those questions at any time, and please do use the upvote button if you have the same question or similar question as somebody has already asked. We will do our best to answer as many questions as possible today. We do have plenty of time allotted for Q&A, but if for some reason you don't get your question answered today, or you remember tomorrow you have a question and the webinar is already over, please email us at slrp@hci.ca.gov, and our team will be happy to work directly with you on that. So let's jump on into the questions that we have so far. First one is verifying that California state employees at correctional institutions are not eligible. Is that correct, Ashley?
Unfortunately, that is correct. Yes.
All
California state employees at a correctional institution are not eligible for the SLRP program.
All right, thank you. Next question. Maya asks, would BCBA board certified behavior analyst working for Department of Human Social Services be included?
Can we pull up the slide with the eligible disciplines, please?
I think the key on this one is they are working for the state. So as long as they're
Good catch.
a state employee, I think
Good catch. That's
that's
right.
good. That's going to be the catch on this one.
Yes, it is. As a state employee, would not be eligible for the SLRP program. Thank you, Chris.
All right, next one. We have for first-time applicants, what time period should my employer use as the reporting period on the EVF?
That's a great question. During the application process, there doesn't need to be a reporting period filled out. That the reporting period dates are used for if an applicant becomes an awardee for the future. So during the application process, the reporting periods can be left blank on the initial EVF form.
All right. All right, thank you. Next question. Do we have to have employment secured by the application date?
That is a great question that I'm going to see if our program manager can answer. Matt, can you assist me with this question, please?
Absolutely. Thank you, Ashley. Yes, thank you everyone for attending this afternoon. With regards to employment, you do have to have on your application listed a future start date. However, it doesn't necessarily have to be while you're applying to the program. So if it's December, for example, that's fine as a start date. It will need to have a start date prior to when our grants will go into effect on March 1st. So you will need to have an employment date lined up before that date.
All right, thank you so much, Matt. Let's see. Next question. Looks like we have a issue with the platform on this one. I'm having trouble entering both of the sites I work for. I work for Santa Cruz County at two different locations. When I enter the second location, it gives me an error message. Should I just enter the main clinic I work at?
Thank you, Chris. For this situation, so our practice sites need to be pre-approved. And what that looks like is I need to, if you could have your worksite administrator email the SLRP inbox, we do need to get your worksite approved for the SLRP before you can actually apply. And if you send an email to slrp@hcai.ca.gov, Meredith, I will respond immediately with the instructions on how to get your worksite pre-approved. And that's the case for anyone that's having difficulty with finding their worksite listed on the application process. The solution for that is emailing the SLRP inbox, notifying us that there is an issue with your worksite populating, and that's how we can start the process for next steps of getting your worksite added. Thank you.
All right, great information there, Ashley. Thank you. And this leads us into the next question. How can we verify whether or not our employment site is eligible and has confirmed willingness to match the award amount?
That's a great question, and it goes along with the one I just answered. What you want to do is uh, email the SLRP inbox, and we'll get that process started where I will be connected with your worksite administrator and get approval for their participation in the SLRP program. It all starts with emailing our inbox.
All right, and we have that email address on the slide right now for you in case you missed it. This is a question I think we were expecting to hear. What is the main difference between this loan repayment program and the MBH SLRP?
Oh, that's a wonderful question. I don't know. I mean, I don't know the MBH program as an SLRP program officer, but there may be someone on this call who can assist me with answering this question. Hoping. Do we have an answer for them?
Yeah, again, as Ashley stated, we can't speak to specifically the requirements of the MEH SLRP, but for our specific California SLRP program, we are federally funded, so we are bound by a lot stricter requirements than some of our other programs at HCAI that we have available. MBH also has a stronger focus on behavioral health, mental health, things of that nature. Whereas we try to award providers across all major disciplines in mental health, primary care, and dental health. So there are some varying factors. Again, we can't speak to specifics, but the biggest one is that because the SLRP is primarily federally funded, we do work on very stricter guidelines. So, disciplines need to be exact, all requirements need to be met. We did read the breach language in our contract because it is so severe. And again, that all comes down from the federal government, which we are governed by. So that's kind of some of the main differences. But we definitely encourage you to look on our website. You can look up the MBH program as well, and it'll give you a lot of great information there that you can use when deciding which program you may be interested in.
Yeah. It's a great answer, Matt. Thank you. And I can confirm, having done the webinars for the MBHS LRP, I think the main difference that you mentioned being the different disciplines, the Medi-Cal behavioral health, which is what the MBH stands for. That program is solely focused on behavioral health programs. It is also a federal program with its own different requirements, and so the state loan repayment program is definitely focused on a broader set of disciplines, and so that would be the main difference. Timing of the cycles as well. So, but yeah, definitely look at our webpage, and each program page will tell you the distinctions between the two programs. All right, thank you. And that is a great question. Next one. Sharita wants to know if they're eligible to work at a local public health jurisdiction. I know we talked about verifying each site individually, but I think the question is more broadly, is this the type of site that is eligible?
A public health, local health jurisdiction. It may be we would, in this instance, I would utilize our HIPSA and our FHQC search tool in order to verify if the work site is does qualify. I would utilize our search tool for the specific address.
All right. And you can find that tool on our webpage. Visit the SLRP page and you'll see that tool there. Next question, Kevin asks, upon successful completion of the service commitment, are the funds sent directly to the clinician or to the entity which provided the loan?
That's a great question. Disbursements are made directly to the grantee from both the practice site match amount and HCAI.
All right, thank you.
Mhm.
Next question, can one participate in this program while completing part-time nurses core education grant funding requirements?
Hmm. That's a great question that I would like to gather more information about. If you could go ahead and email me that specific situation to our SLRP inbox. I'm not sure what the requirements are for the part-time nurses corps educational grant funding, but I'd love to do additional research. And if you email our SLRP inbox, I'd be more than happy to uh, get you answer that question for you. Unless Matt,
I was going to say, just to piggyback a little bit on that, with regards to any HCAI program that we have, multiple service obligations cannot be served simultaneously. So if you were selected to participate in multiple programs at a time, either from us or the NHSC or anywhere else, you would need to choose which program you would like to participate in, as we would not allow multiple service obligation to be served.
All right, thank you for that. Tanya asks, are registered substance abuse counselors eligible for SLRP?
I can
I do.
answer that. We do have a substance use disorder counselor that is qualified for SLRP. Again, you would need to have your full license and fulfill the other requirements of the SLRP. So if you believe you are qualified, we encourage you again to apply, and we will definitely let you know if it's a qualified discipline under that heading.
All right. Um, Looks like Angela has a question about site selection. I know we spoke to this already, so Angela, make sure that you email your site information to the SLRP at hci.ca.gov, and Ashley will get you taken care of on that part of things. Um,
And
the second part of the question is, does the employee location have to match the loan completely?
Yes.
And just a
Yes.
little bit of extra general information. Sorry, Ashley, I didn't mean to
Oh,
cut you
no,
off
that's
there.
fine.
But yeah, so as she stated before, all practice sites this year and even last year will need to be pre-approved for the SLRP and submitted as eligible for participants. In previous grant years, our no match cycles, since there was no match requirement for the sites, that wasn't the case. However, now all of our sites have to be pre-qualified. All sites and site administrators have to confirm their participation and willingness to participate dollar for dollar match wise as well, which is why we have the requirement. And because the program is optional, if they choose or are unable to participate, then we would not set their sites eligible for applications. So, in any case where you're finding that your site is not available, it may be that your site administrator, again, just needs to contact the SLRP inbox, confirm their eligibility and wanting to participate, and we can get them set up with the new practice site as part of the SLRP. And I know some people get concerned about like timeframes, how long it takes. We can have it approved within 1 business day. So there isn't a long delay. As long as they contact us, we can get them set up pretty quickly. And as a general rule, we always say by no later than September 5th, definitely make sure your site administrators contact us because we want to make sure we have enough time for you to complete your application as well as getting your practice site approved. But yeah, for many of those is my site eligible questions, we definitely recommend having your site administration contacting the SLRP inbox and we can get them set up. Thanks,
All
Ashley.
right. All right, thank you, Matt, and good advice there. Next question, are county employees eligible? We've also already spoke to how they know their site qualifies, but county employee eligibility.
County employees are eligible to apply, absolutely. Yes.
Fantastic. Let's see. Next question. Cynthia asks, if I was granted a one-time scholarship while I was an RN student, I work for Ultimed Pace FQHC as an RN case manager, and I'm still on contract. Would I qualify for a loan repayment to help with my loans?
It sounds like you're currently under a contract for a scholarship and having you would not be eligible for the SLRP if you have a current contract in place for a scholarship. Unfortunately, you cannot have more than one service obligation at a time.
And Cynthia, I would recommend please go ahead and email us this question also. There may be a little bit of nuance there as we understand the question and maybe what you might be asking. So if you want to send that to our inbox, we can provide you some additional information and see what your specific situation is like. As Ashley said, yeah, if you do have a current scholarship that requires a service obligation to be fulfilled, you would be uneligible. However, if you are contracted through your organization, that may be a bit of a different situation. So definitely email us and we can get some clarification from you to help better assist you. Thank you.
All right, thank you. And I think this next question is going to fall under that same sort of circumstances for Grace as a BHSP awardee. I think the question will come down to, are you currently under your service obligation contract or not? And so go ahead, if you need clarification on that, Grace, email us, but I think it's the same answer there.
And
All
sorry,
right.
just to provide, oh, sorry, Chris,
Go
just to
ahead.
provide a little bit of extra context there also, if you've been previously awarded an HCAI grant, you are eligible to apply for this grant or scholarship as well, if you've applied for a scholarship previously. Again, for us, it's primarily that you cannot have multiple service obligations at the same time, but you can apply for multiple grants at the same time. You would just have to select one. And if you were chosen for a grant or scholarship previously, but are no longer in a service obligation, you would be eligible to apply for this as well.
Yes. All right. Thank you for that clarification. Uh, let's see here. Um, Confirming again that all state employees, including correctional settings, are ineligible on this next one. I think we've covered that a couple times here. Next question. Should we expect any communications to applicants from the time the application cycle closes and the award decision is made between September 2026 and January 2027? Or should we expect the first communication in January 2027?
It's a great question. We will reach out if additional information is needed when reviewing the applications. So we may reach out if we need additional information between September and January before we make the decisions on if you're awarded or not. But most likely, rule of thumb, you'll probably just hear if you were awarded in January.
All right, thank you. Are mental health program managers able to provide verification of employment or approval, or would it have to be a supervisor?
Specifically, Matt, can you assist me with answering this question, please?
Yeah, in most scenarios, it would be whoever is listed as the site administrator when they first set up the practice site. So that's usually who would be completing the employment verification forms that we have that would be due. So that doesn't necessarily rule out a program manager or a supervisor per se, but in most circumstances, it is usually whoever is listed as the site administrator on the practice site itself. Obviously, we do need some level of authority to sign off on those. So that is the most important thing.
All right, thank you. Next question. Will I qualify if I'm in the loan forgiveness program through studentloans.gov? I believe this is the public service loan forgiveness program.
This is a great question. So the SLRP, we have a requirement of making student loan payments with the awarded funds during the contract obligation time frame. It seems like with PSL left, there's wanting to break up payments to align with the PSLF payments, and that doesn't always align. And so if you were awarded the SLRP program, you would have to make payments during the contract start and end date in the total amount of the awarded funds. So PSLF, it wouldn't deter you from the award per se. I hope I'm answering this right. Matt, am I answering this right? Is this coming out right?
Yeah. Yeah, no, absolutely. So yeah, with the PSLF, and any loans in forbearance or any similar situation, it does not disallow you from being able to apply to the SLRP. However, as stated, once your service obligation ends, 100% of your grant funds received will need to be applied toward your outstanding loans, regardless as to whether or not you are currently still in forbearance or PSLF. So that oftentimes means that a lot of times grantees will save their funds to try and either delay payment or whatnot, or if they're in forbearance, they won't make payments. But at the end of their contract, that does mean that a final payment for the full grant award will be due regardless of forbearance status. Funds cannot be withheld or held on to for future payments. They do need to be made, and per our grant agreement, it is within 30 days of your grant end date expiring. So, but it does not disqualify you from being able to apply, but you still need to adhere to the payment conditions.
All right, thank you. Since we're on the subject of PSLF, there's another question asking uh, if they're a part of it but haven't completed the 120 payments, uh, do they qualify, and should they withdraw from the PSLF to qualify? Do you have anything else to add to the answer to answer that question as well, or
Not much, other than that basically what'll end up happening is that as part of your 120 payments, say you pay, for example, $1,000 a month, and after 24 months, that would be $24,000. If you were awarded the full 50, you would need to apply the remaining $26,000 as a single payment rather than withholding that additional funding for future payments. So it would just basically be one large payment made. It would still count toward your 120 payments as far as we are aware, but it would just unfortunately be a larger sum payment at the end of your grant agreement.
got it? All right, thank you. Another question on site eligibility. Again, please, for all of those, make sure that you email slrp@hci.ca.gov, and they'll get that added in for you. All right, I see LCSWs are qualified to apply. Are ACSWs eligible to apply?
I can take that one. Unfortunately, not. Associate level licenses are not. You do need to be fully licensed as an LCSW or LMFT to apply for the SLRP, unfortunately.
All right, thank you. Let's see. Another question on connections to the states. Demona works as a therapist at the state university. Do state university employees qualify?
No, unfortunately, they wouldn't. And just kind of a brief overview. The reason that, for example, prisons and hospitals, or excuse me, schools, school district, things of that nature are no longer qualified, whereas they may have been in the past, is that we've received updated guidance from HRSA that basically states that they are not considered outpatient facilities and are not open to basically anybody in the general public. They serve whatever group of people that are specifically designated for that facility. For example, a correctional facility only caters to those within that facility and not to anyone in the general public. So that is why, although they may have been qualified previously, due to updated guidance, they are no longer qualified sites. The same goes for most educational institutions as well, schools and universities.
All right, thank you, Matt. Let's see. Angela asks about contacting via any other option other than email. We will be giving our office phone number at the end of the webinar, but I would say that the email is still the preferred and best way to get a hold of us due to the volume of programs that we have and being able to get back easily. So. But we do have a phone number that we will give you at the end of the webinar for that. Just noting that that phone number doesn't go directly to the program. So again, email is the best way to do that. The second part of this question, does the site price match have to be for the same time frame as well? For example, I have an extension for 1 year. Does the match agreement also have to be for a year as well?
Yes. So as part of the contract, yes, the site is required to meet that match obligation within that service year of the contract. We do not stipulate payment terms. It is up to the site. They can choose to pay either monthly, quarterly, at the end of the contract. That is their decision. However, yes, they are under the same stipulation that by the time the grant date ends, 100% of those grant funds that are due are to be paid to you, and then you will be able to apply those to your loans within that 30-day period.
All right, sounds good. Thank you. Uh, this last one, note some of the issues that the FQHCs are having as far as funding and all of that. Wanted to know if there are loan repayment options that don't require an employer match.
Yeah, we definitely recognize that. And we recognize that the benefits of having the no match cycles kind of during the pandemic area was really beneficial. Unfortunately, because we are beholden to the federal rules, these are kind of the ones they've reenacted. But again, we heavily encourage you and anybody here to visit our website. I mean, HCAI has, dozens of different grant programs, scholarship programs, organizational programs that help with funding for these types of situations. So even if the SLRP is not for you or does not fit your needs, as stated, we have the eligibility quiz on our website. We encourage you to take that, and that will give you a great idea of what programs you may qualify for. And as also mentioned, you're welcome to apply for any and all programs that you believe you're qualified for. Most are very competitive, so we do encourage you to apply for as many as you can that you might be eligible for. Again, if selected for multiple, you would only be able to participate in one at a time. But those are also some great ways to kind of hopefully, get you the assistance that you need. And HCAI, again, has a lot of good resources and a lot of programs to fit a variety of needs. So we really encourage you to view our website for that. Thank you.
All right, thank you, Matt. And certainly in that circumstance, if it's behavioral health related, the MBH SLRP would be a good one to consider there. So. All right. Noticed we've had a few questions answered by our program manager, Clinton, and appreciate the help getting those questions answered as well. We do have time here if there are any more questions. We still have about 15 minutes left in this webinar. And so please use this time if you have any questions. Want to remind you that if you just can't think of any questions and then you do 5 minutes after we end or tomorrow, whatever, please email us at slrp@hci.ca.gov. Also want to take this moment while we're waiting for some questions to encourage you to look at the resources tab and check out the web page and the grant guide. And so I see a couple more questions popping up here. Nancy asked, does telehealth qualify?
Uh, Great question, Nancy. Telehealth does qualify, however, with a few caveats. You cannot be 100% telehealth. You cannot live in another state and telehealth into California, and vice versa. You cannot live in California and telehealth for another state. So short answer, yes, but again, there would be more information that would be required if you were to be performing telehealth services.
All right. Thank you. Uh, Next question is, what are the most common reasons people don't get chosen or selected for award with this program?
Yeah, and it looks like Clinton might be providing some information. He is our section chief. One of the main reasons it genuinely just comes down to the number of applicants, the highly competitive nature of the programs, and just the limited funding available. Those are kind of the primary reasons, other than all of our applications are scored accordingly and equally. So we have a scoring factor, but the primary reason is just, a lot of people apply, and unfortunately, we just don't have unlimited funds to grant all of them agreements, or awards. So that is one of our primary focuses. But we do, we still encourage everyone to apply anyways. And not getting an award, for example, this year does not disqualify you from potentially getting one next year. Everybody starts with a blank slate each year that they apply for the program. So even again, if you may not qualify this year, we encourage you to always apply next year, apply for our other programs, and and you may get selected as an awardee next year. Thank you.
All right, thank you. I just want to highlight, just take a moment to highlight a couple questions that were answered in the text and make sure everybody saw those. One of them is just reconfirming the application dates. July 15th is when the program opened. It closes on September 15th. It's an important one for everybody to be aware of. And I know there were a couple questions about substance use disorder counselors, and the answer is yes, you do qualify if you are an SUD or that profession qualifies. Question about how many people are awarded every year, and is it a first come, first served basis?
Um, As far as number of awards, again, it varies based on the number of applicants, the number of the available funding, and whether or not we have full-time or half-time. Uh, we maximize all of our funds. Unfortunately, I couldn't give you a direct answer as to how many people are actually awarded, but we do our very best to award the maximum amount of people that we can. And then as far as first come, first served basis, no. Every application is scored individually. Every application is reviewed individually. And every application is basically scored on the same exact criteria as the next. Submitting an application earlier or later would not increase or decrease your chances of award. Thank you.
All right, thank you, Matt. Uh, let's see. Um, Question about calendar for future HCAI funding webinars. At the end of the webinar, we're going to give you the way to sign up for a monthly newsletter, and that's probably the best way to find out about upcoming programming that we have, and other than just continuing to check back to our website. Question from Nancy. Does private practice providing to lower income populations qualify?
Yes, it does, provided the practice site itself meets all the qualifications of the SLRP, the primary of which is that it does need to be a private, not-for-profit outpatient facility. Thank you, Nancy.
All right. Okay. Uh, from an anonymous user here or attendee, this will be my fourth year trying. Is there anything I might be doing wrong that I keep getting denied?
Honestly, definitely a loaded question, but no, it really, there is nothing. Internally, sometimes there are funding priorities that may occur that may switch around what we choose to first award. But the reality is that our application is based on our scoring criteria primarily, and then we do prioritize continuation awardees. We want to support awardees continuing to serve the public. But other than that, no, it's genuinely the number of applications, the available funding kind of comes back to that. We can only award so many people, and we usually only have so many dollars to do so.
All right, thank you. All that being said, please keep applying, and it's you can't win if you don't try. All right, if you are the owner of a private practice and see clients, so it looks like this is the same basic questions we had before, as far as private practice goes.
Yeah, definitely. I don't want to give you a specific yes or no answer. Definitely recommend emailing the SLRP inbox, kind of laying out the situation, provide us with your practice site address. We can look to see if the site itself is qualified. And then we can definitely let you know if you would be qualified to apply.
All right. Got just a few minutes left today, and these have been wonderful questions. We really value the participation from all of our attendees today, and are happy to be able to answer so many questions. If there are any left, I'll give everybody about 30 more seconds before we move on and get to the close of the webinar. But we do very much appreciate everybody joining us today to learn more about the California State Loan Repayment Program. All right. I'm not seeing any more questions at this point. Matt or Ashley, any last thoughts before we move to the end?
Not for me. No, thank you.
No, again, thank you everyone for attending. We greatly appreciate your time. We know you're all very busy. Please feel free to email our inbox with any questions you have. We are here to take care of you guys. We encourage everybody to apply. You please utilize our tools on our website. We have a variety of information there, our eligibility quiz. We'll have a technical assistance guide up within a matter of days. No, definitely, again, thank you for your time, and we look forward to reviewing your applications.
All right. Thank you so much, Ashley and Matt, for your expertise and hard work on this program. Thank you, everyone, for the wonderful participation. And Matt's message there at the end is a great segue. If you haven't, make sure you click on that resources tab on the bottom to get links to the program webpage and the grant guide. And as he said, we'll have the technical assistance guide up as well. Want to just thank you for joining today. Reminder, the application closes September 15th at 3 p.m., so don't wait to get those applications in. And lastly, before we wrap up, just want to invite you to explore the different resources that we have available, starting with our website, and you can see all of the programs that HCAI offers there. Also want to mention that we are on a number of social media platforms, and we would love for you to follow us there. And as you participate in your health career, please tag us with any great work, especially if you are awarded. We would love to see your journey documented with us by using one of those hashtags and tagging us on social media. As I mentioned earlier, we'd love for you to subscribe to our monthly Health Workforce Programs Update newsletter. You can do so by going to this URL at the top of the screen here, hci.ca.gov/mailing-list, and you will see a number of places that you can opt into different interests. What we would have you do is to opt into the newsletter, go to the section for Health Workforce, and in that section, click on any of those options there, and that will subscribe you to our monthly newsletter, and we will begin receiving those every month. and that's a great way for you to stay up to date on the latest offerings from Health Workforce at HCAI. You can contact us at any time. Again, I mentioned the phone number 916-326-3700. I do want to mention that is our main line, and the best way for you to get information directly about SLRP program is to email us at slrp@hci.ca.gov, and that will get you directly to our program officers, and they can help you from there. With that, thank you again for attending. We appreciate your time and interest. We look forward to your application to the California State Loan Repayment Program. With that, we conclude today's webinar, and we hope you have a wonderful day. Thank you.